Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years of experience, here to talk to you about Medicare coverage of weight loss medications. A summary of the criteria to qualify for these medications. So this Medicare program will start on July 1st of 2026. Patients must be 18 years of older and participating in lifestyle intervention program, lifestyle modification by nutrition intervention, and by physical activity intervention. This program will be based on BMI and associated medical criteria. The program, from a point of view of accessibility, seems to be pretty reasonable because the program will start with a BMI of 27 or greater. So the patients are not forced to meet a diagnosis of obesity diagnosed by a BMI of 30. So 27 will be entry criteria with one of the following conditions, prediabetes being one of them. And that seems to be also a very good proposal because about a third of adults in the United States have prediabetes as defined by a BMI by an A1C between 5.7 and 6.4 and a fasting glucose between 100 and 125. And this is one of the missing links that we've had in weight loss coverage. It's going to take a group of patients that don't qualify because they don't have diabetes and they don't qualify because they don't have a BMI of 30 for these medications, and now they'll qualify with a BMI of 27. I think this is a tremendous move forward because it really will help prevent other diseases and be available for risk reduction of future issues by allowing these patients to be able to receive weight loss medications under the Medicare Bridge program. And another group of patients that will qualify with the BMI of 27 or older will be those who have had a previous heart attack, those who have had a previous stroke, and those who have symptomatic peripheral arterial disease or PAD, usually manifested by symptoms to the lower extremities upon exertion, upon walking, that are relieved with rest. The next group of patients moving forward will qualify if their BMI is equal to or greater than 30 with one of the following conditions. Heart failure with preserved ejection fraction. So usually they'll have symptoms of heart failure, and they may have criteria based on clinical studies that show that there may be atrial fibrillation, there may be a higher blood test that's a marker for heart failure, they may have diastolic dysfunction or congestion seen in the lungs on different imaging testing, and they should have a preserved ejection fraction, so the heart is pumping out a good percentage of the blood that it fills with, and these patients will qualify, but they may need more sophisticated tests. So it may be a little harder to get those patients in the door. They probably need to be seeing a cardiologist and have the appropriate tests to meet the criteria. Another group with a BMI of 30 or greater that may be easier to qualify will be those with uncontrolled blood pressure. So a blood pressure above 140 over 90 on two medications. Many of our patients are taking multiple blood pressure medications, and if they're not easy to control, they can meet this criteria for the medications. And then a group that I think a fair amount of Americans on Medicare will fall into will be the third group in the BMI of 30 or older criteria, which would be chronic kidney disease, stage 3A or higher. And I always like to break that down to just a number that we're looking for in the paper, which is a GFR of 59 or lower. And the GFR is usually estimated, an estimated mathematical equation based on a patient's age, based on a patient's blood creatinine level from blood tests. So I like this criteria because this is going to be on a piece of paper that you'll have or a computer result that you'll have in your chart based on blood tests that you've done. And this seems to be a doable criteria, one that patients may be able to meet, especially our Medicare patients, because it's known that the GFR goes down as patients age. The last group that'll qualify for the Medicare program for these weight loss medications are going to be those who have a BMI of 35 or greater. These patients don't have to have any other medical criteria. They just have to have a BMI of 35 or greater. And this is a little bit hard because as we talk about patients, especially with Medicare, who may have a BMI greater than 30, who meet the criteria for obesity, 35 is a greater number than 30. So it's a much bigger jump in weight. And just to give you an example of that, to meet the BMI criteria of 35 for a 5-foot person, they would have to be 180 pounds. For a 5'8" person, they would have to be 230 pounds. And those are roughly 20 to 30 pound jumps over a BMI of 30. So to go from a BMI of 30 to 35 requires a fair amount of weight to be on hand. However, these patients who are 35 or greater don't have to have any other Medicare criteria. Overall, though, I think in summary, adding on the prediabetes patients to a BMI of 27 greater, adding on CKD stage 3A or higher was really a tremendous move to allow patients who really are at risk for further diseases, vascular disease, cardiac disease, brain disease such as strokes, kidney disease, really can benefit from these medications. And these patients will now be included because many of these patients were not included under prior criteria before Medicare covered it. So even if they didn't have Medicare, these are kind of newer patients to the game. And I think this will include a lot of patients. And one thing that I just want to reinforce, we've reviewed this prior, is that right now there are 4 medications that will qualify for this Medicare program, and that's a pill called Foundayo, a pill called Wegovy, a shot called Wegovy, and an injection called Zepbound. Those will be the 4 medications. So there are older and other medications that have been used for weight loss, different pills that are out there. Those will not be part of this Medicare program. I hope that information was helpful. It's detailed, and we also hope that when the program launches and moves forward, that getting that authorization for the patient will move smoothly and move along well. What's going to happen is the prescription will be sent through to a pharmacy. It should generate a prior authorization request where the office that sends the prescription will need to probably answer some questions, whether the patient's met the criteria for the BMI, for the heart attack, for the stroke, for the prediabetes, for the heart disease, heart failure, chronic kidney disease, blood pressure elevation, all of those things. But I'm guessing that there'll probably be some maybe copy of records that have to be sent. That'll be more than just answering some questions, and that may make the process a little more detailed, but thorough nonetheless, and allow the appropriate patients who qualify to get the medications for this issue. It's also important to just go over who doesn't qualify, who may meet the criteria from the BMI point of view, and may actually have some of the diseases that we mentioned earlier with different BMIs of 27, 30, and also having a BMI greater than 35. So some patients won't qualify. It's expected that patients who have type 2 diabetes will be on the appropriate medications for type 2 diabetes and shouldn't be in the Medicare weight loss program. It's also expected that those who have obstructive sleep apnea, who may qualify for treatment with one of the medications in the program, Zepbound, would be treated for sleep apnea through traditional prescription means and wouldn't be in the Medicare weight loss program. And it's also expected that patients who have liver fibrosis from moderate to advanced liver fibrosis from liver disease, hepatosteatosis, will also qualify for Wegovy through traditional prescription mechanisms and wouldn't qualify for the weight loss program. So again, it seems that the anticipation will be that if you have these other conditions, you should not be going into the Medicare weight loss program. You should be getting the medications through that other manner. Now, as someone who's in practice and is familiar with these diseases and prescribes these medications, I will tell you that is sometimes easier said than done. The process of getting patients treated for liver disease, for obstructive sleep apnea, does not always go as smoothly as planned. And I'm not sure where that's going to go, because there'll probably be some overlap in the system where patients will qualify for both and may have trouble getting these medications through the mechanism that we're using currently for sleep apnea and liver fibrosis, and therefore may fall into the bridge program. And that's something that I think time will tell, and how the prior authorization and documentation process goes. So that will probably be left to be seen how smoothly that goes moving forward.